Good afternoon, you guys. I'm doing this from my desk, so bear with me. So the four elements of negligence, what are they? The first one is duty. The second one is breach of duty. The third one is cause of injury, and the fourth one is damages. So how do we break it down? Duty. Let's say I hire a nurse, okay, and I'm trying to get her to come on board. Now, before she undertake her job, even though she may have some background in nursing, I want her to go through a series of steps as to how my organization do things, meaning um, the steps and processes on that to pass medications, the step and process of what you need to check before you give someone medications. And the reason why I have to do that is because I want to make sure that there aren't any adverse effect. Now, when she undertakes the job and she decides to get along, go ahead and proceed into doing the job with our organization, she undertakes her duty as a nurse. Now, there's breach of duty whenever she deviate away from the way that things are supposed to be done. Let's say you're supposed to monitor the O2 sat, you're supposed to monitor blood pressure before you give them medication, but you choose not to do that, then that's a breach of duty. Now, whenever there's a breach of duty, there's a cause of injury. But the cause of injury will have to be proven that's closely related to the breach of injury. And the cause of injury is pretty much self-explanatory because the person didn't follow the proper protocols, and as a result, there's a cause of injury. Now, damages. Damages will have to, again, you have to show that the damages occur because there was a breach of duty, and because of a breach of duty, there's an injury. So pretty much it's a domino effect, and those things, they pretty much all tied with each other as to the way things are done. Now, the second question is, what are the four elements, or what are the elements that are necessary for consent to be informed, and how healthcare information systems assist in consent management? Now, as healthcare practitioners, before we can proceed into any procedures, whenever it comes to our patient, we have to make sure that they understand exactly the procedure. We also have to give them a chance and a choice between our procedure and whatever other procedures out there, so they can make an informed decision. Now, the informed consent would come from the fact that you give them the proper documentation, you give them the proper studies on all the different um, science that is out there to help them make a consensual choice. Um, Again, the way healthcare information assists in that is we collect that data and we manage that data. So meaning whenever they've been given that proper notice and they are presented with all the proper documentation, then we help manage that. We help manage the studies. We have managed the signed waivers, and we help contain all of that in the system. So if the worst happens, or let's say they try to backtrack, then we can actually prove that we give them the proper notice, we give them the proper choices, and this way we cannot be held liable. Thank you.